Hi, my name is Shelby, and today I'll be inserting a Foley catheter. To begin, I'm going to go ahead and take a look at my provider's orders, and I see that Mrs. Charlene Knight has an order for a Foley catheter with urinary because of urinary retention, and she's been unable to urinate. So to begin, I'm going to go ahead and talk to my patient. Hi, Mrs. Knight. My name is Shelby, and I'll be your nurse today. Can you please verify your name and date of birth? Okay, I see Miss Charlene Knight, 8839, and I do see that Mrs. Knight is allergic to penicillin, latex, and betadine, so I'm going to make sure that that's not involved in the procedure. Mrs. Knight, I have heard that you've had some issues with not being able to urinate, so the doctor has ordered a Foley catheter for you, so I will be inserting that today. So to begin, I'm going to go ahead and assess the site and make sure that it's appropriate to insert the catheter. So I'm going to go ahead and perform hand hygiene. And I'm going to go ahead and put my gloves on. And go ahead and put the rail down. And raise the head of the bed. Okay. Pull this back. So here I'm going to make sure to assess that the area is clean, and I do know that the nurse performed a perineal care this morning, so it looks clean. There's no abnormal lesions or discharge around the urinary meatus. And I'm also going to make sure to palpate the bladder to note any tenderness or distension, and I do see that the bladder is a little bit distended, but that is because Mrs. Knight hasn't been able to urinate. Alright, Mrs. Knight, everything looks good, so I'm going to go ahead and get all the supplies ready. So I'm going to take my gloves off, perform hand hygiene. So I'm going to get my catheter, and I'm going to compare with my provider's orders, and I do see that it matches up, that it's a 14 French catheter. It matches up with the orders, and also making sure that Mrs. Knight's allergies are not involved in the kit, which it looks good, so I'm done with my provider's orders. I'm also going to ensure that the catheter is not expired and that everything is intact. So once I've done that, I'm going to go ahead and take it out of the package. And I'm going to go ahead and use this as a trash bag at the end of my bed. Down here. I'm also going to go ahead and position Mrs. Knight at this time.
Okay, I feel more confident there.
Just make sure your bed is up. Your bed is too low.
I didn't have a blue drink.
I did too.
Okay, and I'm going to make sure that the bed is at a good height, up to waist height.
I mean, I
And now I'm going to go ahead and perform hand hygiene one more time. And position my catheter. Okay, so now to keep sterile procedure, I'm going to make sure that everything is at waist height, and I'm going to go ahead and begin right here. Grabbing the 1-inch margins, I'm first going to pull away from me to open up the catheter, making sure that it doesn't fold back on itself and not reaching over it. And then I'm going to grab the left field.
And then it was like,
Again, only touching the 1-inch margins.
so I just have to remember the number.
Then I'm going to go ahead and grab the right, the 1-inch margin.
Let's see.
And finally, I'm going to pull towards me.
This is just a prep.
Okay, to make sure that I have enough space, I'm going to go ahead and position this around, not reaching over my field.
I just feel like
Okay.
injection.
Now, I'm going to go ahead and grab my blue drape, and I'm going to grasp it on the shiny side, and only grabbing within the 1-inch margin.
So this one definitely takes
Go ahead and take a step back, and grab within the 1-inch margin. Now I'm going to go ahead and lay it over here, not reaching over or letting it touch anything. Okay, so now I'm going to go ahead and put on my sterile gloves. So I'm going to grab this
I saw that. I didn't want to say anything.
and bring it over here.
Okay.
Again, I'm making sure not to turn my back to anything.
I dropped
I'm going to go ahead and open my gloves over here.
Oh, it dropped inside a box, so it's fine.
Oh yeah, mine got stuck in a box at first. I'm like, oh, you can talk away, it doesn't get stuck.
So yours, when you were doing it, you said.
I did not use that.
No, the first time you
Okay,
did it.
here's what happened.
Okay?
Yeah.
Now I'm going to put my hands underneath here.
The lube like hit it and then went in with it. Yeah.
Like, I had it basically, it was like this.
Okay? Again, not touching my 1-inch borders. Opening up.
Yeah.
Now I'm going to go ahead and take my non-dominant hand and grab my right glove,
Oh, you shot.
pinching it at the border, picking it up and stepping back. Now I can touch this part, and I'm going to go ahead and put my 4 fingers in.
Well, I'm dead now.
Making sure not to contaminate.
I would, it's like that, don't turn your head away from the maybe I see it all.
And keeping my hands above my waist. Now that I have this one on, I'm going to go ahead and take my 4 fingers and put it right underneath.
No, not like this, but like this.
I'm going to go ahead and lift it up, step back, put my hand in,
And I'm gonna make it in time for Sunday anarchy.
I mean, you don't have to put it
and I'm then going to supinate my hand into the glove.
Best show.
Now that I have them both on and that they are not contaminated,
Don't give me like I should.
together, I'm now done with this.
It's like the motorcycle
So I'll set that away.
show.
Now again, I'm back to facing my 2 sterile fields. I'm going to go ahead and grab this white drape first.
Yeah, that's my
Step back,
if I
so I'm
wasn't
not reaching over my sterile field.
scholarly, yes. If I didn't want to be a scholar, then I would have a more Well, I can afford
And
them,
I'm
so
going,
when I
my hands
when
are
I
not
do my
sterile, so
degree,
I
I'm
can
buying
touch
a
it.
Harley.
Just want to make sure I'm not touching my patient as I'm laying it down over the field.
I'm gonna buy 2 bucks.
He like built it himself and then he crashed.
Okay, so now that I've done that, I'm going to go ahead and reposition my box for a little bit of ease.
Big Daddy.
And I'm going to begin with the hydrogen peroxide. And I'm going to go ahead
What order
and
is it? White glove.
open this. And as I throw this away, I'm just going to drop it over here because I don't want my hands to go below my waist.
Blue gloves,
I'm going to pour that over here. Go ahead and drop this over here. Then I'm going to go ahead and take the lube.
if you're gonna use separate gloves,
Drop it over here.
out of your external package.
And put it in this
Out of this
little
part.
right thing right here.
If you're gonna package them like you just did,
Oh,
And
yeah,
This is just my practice room. Yeah. I have
I'm then
to.
going to remove this
So the sterile field
here.
that we put over the Purina.
and begin by taking my sterile water, taking the cap off,
you have to have sterile gloves on.
and I'm going to go ahead and look for the balloon, and I do see that this can hold 5 to 10 milliliters, and I'll be placing 10 milliliters inside.
Practice with, they probably didn't practice enough.
No, I
I'm going to go
have
ahead and
that
put
out.
this back in.
Is it this?
I'm then going to take the catheter, which is now in a sheath, and I'm going to make sure that it is not going to touch anything as I take the sheath off, holding it tight.
Dude, that happened to me the first time I thought I was in the bladder, but I really wasn't.
Again, not reaching below. Now I'm going to go ahead and take this catheter, and I'm going to lube it
A little
up.
bit. But yeah, it's like
Once I'm all done with that, I'm going to go ahead and place it back inside my box. I also see that there is a urine sample cup, which I don't need, so I'm going to go ahead and leave that right over here. Okay, so now I'm done preparing, so I'm going to go ahead and put this back on here. And I'm now going to move my sterile procedure over to my patient. So I'm going to go ahead and grab this, place it over here, not reaching over, set it down.
We tried that this
I'm now done with this, so I can take this out of the way.
What did you email?
So to begin, I'm going to go ahead and clean. So I'm going to take my non-dominant hand and I am going to purposely contaminate it by placing it over here to hold open the labia. I'm going to take my right hand and I'm going to go ahead and clean from clitoris to anus. I'm going to start with the outer labia, coming around, dropping it in. Coming back, cleaning the inner, coming around, dropping it in, cleaning the middle, coming around, dropping it in. I'm going to do the other side now and do outer, coming out, around, inner, clitoris to anus again, coming out and around, and again middle, coming out, going around. Now I'm done with these, so I can drop this in here. Keeping my non-dominant hand over here, I'm also going to take this, move this over here. I am now going to begin inserting the catheter, so I'm going to make sure to tell Mrs. Knight that she's going to feel a little bit of pressure and ask her if she could bear down because I am about to insert the catheter. So I'm going to go ahead and grab 2 to 4 inches from the top of it, and I'm going to visualize the meatus and go ahead and begin to insert, making sure that that my hands are never touching anything to keep everything sterile, and gently putting it in to 2 to 4. Okay, and then once I check for urine, I'm going to insert another inch.
It was like, what's the order for assessment on the abdomen? I changed it the last second, so we got wrong one.
Okay, and once I feel a little bit, I'm going to go ahead and insert my sterile water into the balloon. Insert the 10 milliliters.
I
found it on the ground and I thought I lost it, so somebody never dropped it from the ground.
I'll stick it right there.
Okay, once I've done that, I'm going to go ahead, pull, make sure that it stays in, and then I'm going to go ahead and unattach this. My sterile procedure is now complete, so I'm going to go ahead and take the bag. I can go ahead and rip this off. And I can take the bag and I'm going to secure it, the bifurcation, to the inner thigh. And then I'm going to insert the bag to the bed. And not to the rail to make sure it doesn't move. I'm then going to make sure that Mrs. Knight tolerated the procedure okay. And I'm also going to inform her that I'm going to perform catheter care upon every shift. I'm also going to document accordingly the input and output and the color. I'm then going to take my gloves off, perform hand hygiene, and I'm done.